Good evening and welcome. I'd like to talk to you this evening a bit about the nuts and bolts of telemedicine. And as a part of that, we want to discuss some of the issues with family-centered care. My name is Kelly King. I'm the Family to Family Health Information Center Coordinator here at the Peel Center. And I have a colleague with me this evening. Anna, would you take a moment and introduce yourself?
Sure, Kelly. Good afternoon, everyone. My name is Ana Pacheco, and I'm one of the parent advisors for the Peel Center, and it's a pleasure to be here this afternoon.
Thank you, Anna. And Anna's going to be doing a repeat of this session in Spanish a week from today. So if you have any individuals who would like to join, we'd be delighted to have them. Take a look at our website for the connection information. Just a little bit of housekeeping. We are recording this session. So if you join late, please know that we will be recording it so that it will be available on our website for your future viewing. And then there is the chat button that you can use at the top. And if you would like to raise your hand, there may be some opportunities for you to share something with us. The place I'd like to start this evening is to talk about the funding of this telehealth project, and as a piece of this webinar that we're providing for you today. So this program is being supported through the Health Resources and Service Administration. You may know that as HRSA, and specifically the Department of Health and Human Services. And these contents are not those of the authors, and they don't necessarily represent the official views of, nor the endorsement of HRSA, the HSS, or the United States government, just for your information. So tonight we're hoping that as you participate with us, some of you in fact may have had some experience with telemedicine in the past. And in fact, I did. I was doing telepsychiatry connections with families probably 10 years ago. But COVID-19 has made that not only an option, but in many, many cases, a necessity for most of us to connect with our healthcare providers. But unfortunately, if you didn't have any experience with telemedicine, there could have been a pretty steep learning curve for you. So this is being brought to you this evening to take a look at some of these learning objectives. And that is, options for getting connected, figuring out what devices are and how you can use them to attend a telehealth appointment, to think about the difference between some of the ways that we connect, some of those terms called portals and platforms, and then, talking about a bit about what needs to be done before, during, and after your visit with your provider. So we hope to help you to identify some of these things and feel more confident in your telemedicine appointment. I think it's important when we start talking about telemedicine that we have a common understanding of what that means. So some of the definitions are often used, as you'll see there, interchangeably. Telemedicine is really very, very broad, and telehealth is very, very broad. Telemedicine is more the clinical aspect where you would meet with a provider, some type of a practitioner, a doctor, a PA, a therapist, somebody like that, getting the clinical aspect of your care, where telehealth is virtually any kind of information that has to do with health provided through an electronic format. So most of what I do as a family to family health information center coordinator, when I'm talking to a family or an individual about a healthcare need for their child or their young person with a disability or a special healthcare need, the understanding of that by the federal government is that what I'm doing is telehealth. So it's really very, very broad and encompasses a lot of things. So we want to start just briefly thinking about, what it means to be connected. Perhaps one of the first challenges you had was connecting with your provider. And in fact, I can't remember how many telemedicine appointments my son has had with various providers over time. And as you're going to see, they don't all make a connection in the same way. So it could be a bit complicated because there isn't just one right way of doing it. There are perhaps many different ways. And, tell anything starts with some kind of connection. So that's where we're starting this evening. Well, what does it mean to be connected? So data can be a lot of different things. So for example, you can make a telephone call. If you're on a telephone, your voice is a connection. My voice is being carried to you through the internet this evening. That takes data. If you're using a mobile service, that would be happening through the air. And when you send a text message, as so many of us do these days, that too is data. All of the letters that form words are each pieces of data. So sending an email, posting a photo on Facebook or other type of social media, making a video call, and of course, a telemedicine appointment. All of those have to do with data. And many of them involve a lot of data. So a video and audio connection like we're doing this evening is going to take a lot more data than simply sending a text message. So you can be connected in many, many different ways. And I have several of those listed for you there, which are some of them that we already mentioned. But there, again, are a host of different ways to do that. There are both ways you see at the bottom, the cellular mobile, which you would use your phone for, versus doing it with an internet, with an Apple device or a computer using a broadband. Maybe you have Wi-Fi, or you're making a connection that way. So there's a distinction in not only various types of data, but the way that you use that data to make the connections. So unfortunately, we don't all have the best ability to connect. And sometimes if you're perhaps in the middle of a city, everybody's pulling on the internet, and it makes it very difficult to keep your connection strong. I live in a rural community. This background you see here behind me isn't my home, but sometimes I show pictures of my yard or the community around me. And my internet isn't always great because I live in a rural community. So there are a lot of other ways that people can get connected. So sometimes I go into town and I use the library if I'm having a particular trouble. Sometimes students use the school. You don't necessarily have to go into those buildings to use their Wi-Fi. McDonald's and Dunkin' Donuts and Starbucks often have internet that you can be sitting outside in the parking area and use their services to connect. So those are options if your connection at home is not good enough, or if you can't be connected at all. Sometimes people who use their phone don't have any more time on their data plan, and you could connect via Wi-Fi at one of these places so that you could still use your connection. So the next area I want to talk about briefly is, do you have a device? So it's another important aspect of telemedicine. What do I mean when I say a device? There are some various categories. First of all, there are various kinds of computers. They don't all look the same. Some are more portable than others. There are lots of different tablets, the Kindles, the iPads, lots of different kinds, Android devices for phone as well as iPhones. So those are three various categories, but they're all ways that you are able to connect and share data across space or the internet. The area that we want to talk about most with you this evening is about seeing your provider. When we say seeing your provider, we mean actually making that telemedicine connection for you. And what does that mean in relation to the family-centered experience? Both Anna and I have children who have special needs. My older son is on the autism spectrum. He has not been out during COVID, so all of our appointments have been by telemedicine. Most of those would be a trip of 2 hours for us. And so it's been pretty convenient for us to see our provider electronically and to do that through the telemedicine. Anna, how about you? Have you had experiences with telemedicine?
Yes, during this pandemic, at the beginning, I remember many of my son appointments, especially they were canceled at the beginning until the doctor office figured out how they are going to make those appointments happen. And I have to say that I started using telemedicine not only for my son, for myself too, and many of the information that we are listening this afternoon, this evening, it's I have been using it. It's start baby step under at the beginning I was very nervous. I wasn't sure if I was doing the right correctly, and especially when we have to learn different platform, and it has been a learning experience and very, very successful and useful. Yes.
Wonderful, great. And I think, people have had similar types of experiences. It's been a learning challenge for most of us.
And not only for us as a family members, also doctors. They are not used. They have been learning also with the whole situation. So it has been a learning curve for both sides, the provider
Absolutely.
and also we the families.
And you said, there was a little gap in there. They had to get going and get those things set up when they weren't used to using them. So that took a little bit of time at the beginning as well. Great. So, when we stop to think about the how we see the provider, and we've used the terms platform and portal. And, in order to see your provider, it's important that there be some type of software. That software, as you'll see here, is often called a platform. That platform could be accessed through what's called a portal. So you would be able to see your provider and they could in turn see you. A platform is simply a type of secure telehealth software system that allows you to have that two-way video connection and interaction. A portal, on the other hand, is a website or page that provides the access or links to other sites. So use one to get into the other, and usually it's the provider that determines which one you're going to use because of their healthcare system that they're working with or their office. So you don't usually get a choice of how you want to connect. It's the one that they provide you. So these are just some examples for your information. And again, as I said, I had to use various types of ways to get my son connected to his doctors. So hospitals themselves have had portals. We've used those. There's, Skype, which it seems pretty unusual. My chart, DoxyMe, those are all very simple methods to make connections, and even Zoom. Zoom is not something typically that providers use, but I have used both Skype and Zoom as well as hospital portals rather, to make visits with the healthcare professionals. And again, remember that even though you may feel comfortable or have some experience with using one of these, you don't usually get to make the choice. And then the physician will usually send you some connection information either through a text or to your email, or many of the portals have a type of way that you can send a message through there, and that's how you would connect with the practitioner. So when you go to the doctor's office, you have to go into an examination room. And very similarly, for a telehealth appointment, you also have to open up a virtual door to see your doctor. And why? Well, you need some privacy, right? So there are some keys. And in order to keep it private, you don't want everybody knowing about your health care. There are laws that we're going to talk about in a moment to protect that information. So there have to be some keys to open those doors. One of them may be an email. Again, I may get an email where the doctor tells me how I can make this connection, and it could be a text. There could be a log on at the portal, or I may have to make a telephone call. So there really are different ways, but it is an electronic door that you need a key for in order to protect your information and to keep it confidential. Just
And
like you, oh, I'm
and
sorry, Anna.
Kelly, I want to add that my experience is that provider offices, they work hard with the family to make sure that this is an easy way to access. Some of the links that I have been receiving to use to do the telemedicine, most of them, they have been by text messages or simply a link to an email. And they really work to make sure that it's easy and simple for the patient, and never hesitate to reach out with any question to your provider office.
Absolutely. And I would say that, you know, even while they had a pretty steep learning curve, just like we did as patients and family members at the beginning, they have been doing this every single day. So they are more experienced now. And they really, in my experience too, Anna, have done a very good job giving very clear information about how to connect with them. So as Anna said, don't hesitate to call them. Just as you use email or some type of an app and you have a username and a password, could be Facebook, anything at all. There are also login words that you need to know with regard to telehealth and telemedicine. So the web pages and the websites are specific collections of information that are displayed to you, and they can, you know, you might think of them like a book. And the website, I'm sorry, the web pages are pages. The website is a book. So you can go through those pages on the website. So PO has web pages. There are web pages. We have a website. There are web pages about health. And so you can go through each of those to learn more about healthcare and some of the aspects of healthcare that we help families with. Those are all hosted on our webpage. Software are either programs, applications, or operating instructions that are for the computer or the device that you're using. And then the apps, which are short for application, essentially means the same thing as software. However, those are things that are used on mobile devices and smartphones and tablets. So it's important to know these because those words are ones that your practice might be using to tell you how to connect. So our local hospital actually has a specific app that you can download, and that's how you have to get into their portal to make your appointment, to do your scheduling, to connect with your providers and do your telemedicine visit. Others are completely different. I told you we were going to talk a little bit about privacy. And so HIPAA, which is the Health Insurance Portability and Accountability Act. A lot of big words, but basically what it means, it's a law that's about health information, and it is specifically about keeping your information private and protected. And there's sometimes a word called PHI, which is protected health information. The information that can be shared and stored by anybody other than me, myself, or I, if the information is about me. So most of your health information is protected by this law, HIPAA, including personal information that could be used to identify you, such as some of your health history, your status, and even payment information. But HIPAA doesn't protect health information that doesn't explicitly link it to you. So if it's separated from you, and remember, you always have to sign when you go to the doctor's office about billing your insurance because they're going to be sharing some information about you. But maybe they're doing some research, and that's just an individual, and your specific information isn't tied to that, and you agree to that. Essentially, it's anonymous. They can't link you with the information. And so that kind of information is okay to share. A lot of it takes your permission to do so, but doctors are very careful about that and don't want to get into any trouble and share information about you where they shouldn't be. So during a public health emergency, there are some provisions to HIPAA because the connection that doctors had to make with us for telemedicine meant that additional platforms were sometimes necessary to make connections with patients, and they didn't all have, HIPAA compliant ones in place. So there are provisions that it had to be done in a good faith effort, and that it was non-public facing. In other words, it wasn't readily accessible to the public, and that people couldn't jump in there on it. So again, things like Twitch, Facebook Live, and TikTok are not things that could be used, but they were allowed to use FaceTime. I already showed you Skype and Zoom. So some things were permissible while others weren't, depending on if indeed they were not non-public facing or not. Most of the platforms include several things, and among those are the video calls and chats, a shared screen, and of course, as I said, HIPAA compliance, but not all are HIPAA compliant, as we just reviewed. There are lots of things you can do, perhaps in a portal. I regularly connect with my doctor and tell them, what's going on. If there are some problems with medications, I can get information about tests. I can actually download lab work that's been ordered. I can find doctors and send medicine or medications and messages to them. And I'm sorry, I can't send medications. I can get a script for medication. Whoops, I'm backwards. And then you can have access as a parent to your children's medical records. And even as they turn 18, if they give you permission to do that, you could continue to get connection to their records. So just a little family story. We all have our family stories, but in this case, this family, it was a young lady that was living with her grandmother, and the pediatrician's office wanted to connect with her through a telemedicine visit, and grandma didn't understand how to do that. So the physician's office actually gave her some instruction. When she got off the phone, she didn't have a lot of confidence in doing it. So she called back and asked if they could have the appointment by phone. The doctor reassured her and said, absolutely. So the grandmother felt really reassured that was something that she was comfortable doing because she was on the phone often. And so it's never wrong to ask for additional help. That's what our physicians are there for. And if you need something done in a different way, definitely ask and see what can be done about that. Sometimes you just face barriers, and there are a lot of options for people who can help you. And I told somebody today in a conversation, I was having problems getting things to go onto my work calendar, and I wasn't able to find the links that I needed to connect with some meetings, because I must have got a setting wrong. And I said, I'm going to have to wait till my son comes back from school in 2 weeks, because we thought it was pretty funny over there on the right. It says, ask a teenager. But boy, kids know how to navigate these devices and how much of this works. So don't hesitate to ask people to help you. Sometimes it's people in your community. And as we have already said, call your provider, talk to the nurse, ask them how it works, reach out to their staff. Don't hesitate to ask and get the support that you need to make this visit successful. It's also important that you take some time to test your platform, and you should do that well in advance of your appointment. It's a good idea to do it 2 days in advance, because if you do have a problem, that's going to give you some time in order to be able to navigate it and get it fixed. And then in the end, ultimately, if you cannot access the platform, you don't have what you need, call the provider, call their office number, and try not to wait until the day of the appointment or just minutes before, unless that's the first opportunity you have. So you're on there, you're waiting. If something goes wrong, do call them, but try to do that in advance and make sure you have logged in advance. So if there is a problem, you can figure out another way to connect. The first telemedicine appointment, and as I suggested, probably for most of us, this has already happened, and that's okay. And for some of us, maybe we weren't comfortable with telemedicine. And, Anna and I have actually had this discussion. What does that, if you're just thinking about it, the doctor can't necessarily check my blood pressure. He can't feel my abdomen. He can't test my breathing. He can't take my pulse. So, is it really worthwhile to have a telemedicine appointment? Well, that depends. So, if the doctor doesn't feel that there is value in that telemedicine appointment, and or if you don't, they may call you to come in, or you may say, I'd like to come in, or I'd like to delay my appointment. Maybe you're not comfortable going to the doctor's office right now because of the pandemic. However, you could reschedule that appointment, and there are plenty of reasons to go to the doctor. Most of the pediatricians were up and running, following safety protocols pretty quickly after the pandemic hit because children needed vaccines. They needed to check that they were developmentally making progress. So it wasn't unusual that a lot of people were getting in there. And again, the doctors had to follow the safety protocol. But if you haven't had that appointment, let's learn a little bit about that. So it's important to understand what family-centered telehealth means. And when I talk about family-centered, I'm talking about aspects of what we call medical home, making sure that there's health and well-being and that children with special needs and their families actually work together in partnership with the provider to make sure the needs of that family are culturally and respectfully and comprehensively and in a coordinated way met. So there are both rights and responsibilities when we're talking about family-centered telehealth. And care by telehealth should be very similar to the type of care you would get if you actually went to the doctor. So as you'll see there, it should be considerate, respectful, and compassionate. It shouldn't matter any more than if you were in the office, what you look like, who you are, and what your race or religion are. If you have questions, just as if you were in that office, you have the right to ask those questions and get appropriate answers. If you have a plan of care, you should be part of revising that, making sure that it's been changed to meet your needs in this situation, in a changing situation. Same way you got copies of documents before, you should be able to get them again. Maybe they have to be mailed, maybe those can come through a portal and those be printed at your home, but you have the same rights that you had before. You also have the right, if you have any need for vision, hearing, speech, or language accommodations, to get those just as you did in the live office. But it is important in this case that you ask for those things in advance. While you may think, well, my doctor knows me and they should realize that I need those things. Those reminders are really important so they can get the people in place or the tool in place to help you during your visit so you can have a productive meeting. And then just as if you went to the office, you could have somebody with you at your appointment. They can be present with you, but it's a very good idea to tell the doctor who is there with you. This is a particularly important issue when we're talking about young people who have a right to talk about their mental health and other issues with the physician and to do so privately and to get those issues addressed. So if you have a youth, teenager, and the doctor asks you to step away and or there's not a private space, please do everything in your power to honor that request and give that young person the opportunity to talk to the doctor one-on-one. And then always, if something isn't going right at the visit or you feel uncomfortable in any way, you always have the right to stop the visit, just as you could walk out of an appointment if you were at a doctor's office. Anything more there that I missed?
Sometimes we used to have earbuds for our telephone to talk by the iPhone, or we can use that for the computer. So that can help you if you are surrounded for other people, you are in a place where you are concerned that other people are listening what the doctor is saying to you, you can minimize that that the people listen to that information if you have access to use one of those devices that typically we have that we use with our smartphone.
The other thing, you could think about when you're scheduling an appointment to try to make it at a time that's less busy and there aren't as many people in your home, but the best laid plans don't always work out, as we all know. So as I said, along with some rights, there are also some responsibilities. So just as you would prepare to go to the doctor's office and come with that new information, you should come to your telemedicine appointment prepared to share new information with the provider, prepared to participate as much as possible, make a list of your questions in advance. And sometimes the doctor, well, they can't maybe check your heart rate and your respiration, they may ask you to assist with some piece of your child's evaluation and examination, or your own perhaps. Show me this. And so occupational therapist could have you show how the child opens a jar or a bottle. I was looking for one here on the counter. You could have something to do with your child. And ideally, they would ask you to have those things available in advance. But there are ways that you could participate in the exam on your end, and then just videotape, or I'm sorry, put the camera on the child as they do that activity. So there are also some other names for a telemedicine appointment, and I don't want you to be confused. Unfortunately, it's relatively new. While telemedicine has been around for a while, it's new to most of us. And so one part of the confusion is all of these other names that are here. You simply need to be aware of them. They could be called something else. There are also some considerations for things that are really good ideas. Consider these as like tips. So before the visit, we've already talked about, you could be in a place that's very crowded and noisy. Anna gave you some ideas about keeping that noise under control. We mentioned the confidentiality and the need for young people to have the opportunity to talk to the physician alone. We've talked about the internet connection. If it's breaking up a lot, do you need to go somewhere else that has a better connection? Or is there another way you connect that could be more, you could be more confident that the meeting will go forward? And then if you're in a dark spot, light is beneficial. So just simple things, but some things we don't always consider. And then, is your device ready? Did you test your connection to the platform or portal ahead of time? Do you have just a piece of paper and a pencil? And then if you have to do something for the doctor, is that there? Maybe, I've actually taken pictures inside my son's throat for the doctor. So you can do things like that if that's something that would be helpful. And then, some of the information that you need to share, if there have been any medication changes, or there are new doctors that are involved, or new professionals, anything that you've seen that's different. And then it's also really important to prepare your child or your young adult, because this is a different type of experience. You're not getting up, getting dressed, having to go to the doctor's office, park to go in and wait, et cetera, et cetera, et cetera. Your typical in-person visit is different. So what do you need to do to prepare? So in a little more depth here, there are some tools that you could actually use. This is one from National Family Voices that could help you to prepare for the visit. And you can, taking your notes, both in anticipation, and then you could flip it over and jot down some ideas during the visit, or answers to the question. This is one of many tools that might be helpful to you. It's also important to think about your insurance coverage. And while insurance has been very generous in paying for most telemedicine during the pandemic, that is impacted by both state and federal laws and insurance company policies and procedures during the pandemic. And this changes. And so I don't want to tell you once for all that telemedicine is going to be here to stay with your insurance company. So do check with your insurance. Your doctor may well be aware if your insurance is continuing to do telemedicine or not. But because of the frequent changes, it's important that you check before so you don't get an unanticipated bill in the mail. There are also some important things about scheduling an appointment. So just as always, you can call the provider. Now, I've actually lapsed in scheduling a couple of my son's appointment because what was typical is on your way out the door, you stopped and scheduled the next appointment. And now you have to remember to ask when that provider wants to see you again. And then you have to follow up either by making a telephone call or logging into the portal or one of these other ways to make that scheduled appointment. So don't forget to do that because it's important as a follow-up. When you do schedule, there are some questions that you might want to ask because the telemedicine appointment isn't necessarily going to be as long or as short as if you were seeing someone in person. And then getting the forms updated is sometimes more of a challenge to do from a distance. Can those be mailed to you? Can you do them on the portal? You need to see how you're going to make the connection. So those are important things to ask. And remember, we said, if you need any accommodation, ask for those when you schedule so that those can be arranged. And it's not a bad idea if you ask for some accommodation to call a couple of days ahead just to confirm that they have that in place because things change and things are forgotten. During the visit, if you have a kiddo there, they can be present. You may again have to do some things that help the doctor, physician to see what's going on. So again, you probably don't have a tool, a sphygmomanometer, to take their blood pressure, but you can take their pulse perhaps if you have a stopwatch or if you can do that with a watch and are able to find their pulse on their wrist, or you might have to take their temperature. Most of us have a thermometer in our homes. You might have to push on their stomach as the doctor, the physician would ask you to do. And as I said, other types of activities, especially the developmental pieces for the little toddlers, it's important for them to see some of the skills that your children can do. If you have little ones, they're going to tend to interfere. If your little ones were like mine when they were little, when I was on the phone or busy doing something, that's when they either got into trouble or wanted my attention. Was that the same with you, Anna?
Yep.
So, what do you need to do to meet your child's needs before the appointment and during the appointment? That's basically what this is about. And then, same thing for the older ones. Where and what do you need to do to prepare them in advance to make this a successful medical appointment? And
I think that what we need to remember is that we are indeed having a doctor appointment. We are seeing our provider, our doctor, in the same way that we get prepared to go to the office. We are getting prepared. The only difference is how we access and we see our doctor. Instead to drive and to get in a building and in an office, we can do that in our home or any other place, but we need really to get prepared. And when we have our children with us or young adults, we have to prepare them too. The same is exactly the same, so they can have a pleasant visit, so they can be seen and they can participate on that visit.
Absolutely, Anna. And you again, You may not think about, getting up and getting dressed to the same degree that you would to go out to an appointment. And yet that's not always a bad idea to make it seem different than usual, and that this is something beyond what we do every single day. So even that isn't a bad idea. But again, preparing them, great ideas on it, yes. When we think about next steps at the end of your visit, if there's any plan, any new diagnosis or the current diagnosis that needs to be discussed, stop, make sure that you're comfortable and that you understand and that you've asked your questions, just like at a regular visit. Are there referrals? Is there any lab work? How do I get those? Are you going to mail those to me, or is it going? Are you going to call the pharmacy? And if you believe that this didn't work out for some reason, if it wasn't long enough, talk about that with the provider so that some changes can be made in anticipation of the next visit. The nuts and bolts of telehealth are what we have talked about, thinking about getting connected, devices, ways to see your provider and prepare. And we just like to say that absolutely you can get connected. You have a device, you have ways to see your provider and ways to prepare for your visit. You know what to do, so get out there and make sure your healthcare needs are being met. We also have a brief survey. Now, I put up there to take a minute to fill out this brief evaluation, but Anna and I will be quite honest with you and tell you it's going to take you a few minutes to do that. But it's really important that you do so. The organizations that have put this together with a lot of labor are wanting to use the information in these trainings to make your experience with telehealth better and to learn how learning about telehealth has been helpful for you. So while it will take a few minutes, it's really important that you do this. So could you do us the favor and go there now and get this evaluation completed for us, please? I need to put that in the link. So let me grab that and put it in there for you if I can. It doesn't want to do it for me. Okay.
Let's see if I can do that, Kelly.
And you can take a picture of that QR code and put that in as well. I think Anna's actually typing it in for us.
I think, yes. Please,
That's okay. We'll take a moment because it's important.
The link to the evaluation is in the chat.
Thank you again. We really appreciate your help with getting that completed for us. And then we also like to thank you for joining us today. We really enjoyed talking to you about this important subject. And just to remind you, we're here at the Peel Center for you to help with educational issues as well as healthcare issues. And when I'm talking healthcare, and children and young people with any healthcare need. Now, we service individuals from birth to age 26. But if it's anything about a child with special healthcare needs, it fits under the family to family information to support you. So don't hesitate to call us. You can either email us at that email address there, or call us at the telephone number there. It's a toll-free number. And Ana Pacheco would be happy to help you if you speak Spanish. And you see how remarkably she can help you with English as well. But I don't speak Spanish, so if you do, you're going to have to talk to Ana. And I'd be delighted to take any of your calls. So my name again is Kelly King, and thank you so much for attending.
Yes, and please remember, if you know family who speak Spanish, this session will be presented next week April 27th at 7, using the Zoom platform. Families can they can register using a link. We have that information in Peel Center community calendar in our website, and also they can call us or reach out to me to 1-866-950-1040, and my extension is 220.
And our website, which is really small down in that on that map of Pennsylvania, is simply www.peelcenter.org. www.peelcenter.org. So thank you once again. Delighted that you could join us.
Thank you.